Hello guys, welcome back to my channel. My name is Satwika, and in this video we will continue the topic of trauma and stressor related disorder. In the last video we have covered the first two of the disorder, the reactive attachment and disinhibited social engagement disorder, and now we will continue the three other types of trauma and stressor related disorder. All right, the first one is post-traumatic stress disorder, or abbreviated as PTSD, and it is a serious mental health condition that is triggered by traumatic events, of course. Either you experiencing it or you witnessing it. So the symptoms may include flashback, nightmares, severe anxiety, or like negative thoughts about the events. So most people who go through traumatic events may have temporary difficulty in adjusting and coping. Yeah, it's a normal reaction, but with time and good self-care and support from family, they usually get better. But if the symptoms get worse and last for months or even years and interfere your day-to-day functioning, you may develop PTSD. So according to DSM-5, the diagnostic criteria, PTSD survivor may develop several symptoms here, and generally grouped into 5 types. The first one is the exposure, of course, the intrusive symptoms, the avoidance, the negative thoughts and mood, and the hyperarousal or reactivity. So these symptoms can be vary, from person to person and over time. And let's learn the types of the symptoms more carefully here. So the first one, of course, someone who is diagnosed with PTSD has been exposed to either actual or threatened death, or serious injury, or sexual violence. They could directly experiencing the traumatic events, or they could witnessing, but in person, the events. Okay, even though they're like only witnessing, they could also develop PTSD. And the traumatic events, they learned that the traumatic events occurred to a close family member or a friend, right? And also people could develop PTSD by experiencing repeated or extreme exposure to the aversive details of the traumatic events. Yeah, this is the example is police officer that repeatedly exposed to details of child abuse. They also could develop PTSD. All right, so however, the criteria of exposure here does not apply to exposure through electronic media. So if you if you witnessing traumatic events through television or social media, it's not including in this diagnostic criteria. All right, so the second symptoms or the second criteria is experiencing intrusive symptoms after the traumatic events. Yeah, this include the recurrent and intrusive distressing memory. Yeah, it's also involuntary. That is like coming to the survivor, the memories of the traumatic events. And also they could experience nightmare, yeah, in which the content and or the affect of the traumatic events is inside the dream. It's related to traumatic events, followed by strong emotion as well inside the dream. And the intrusive symptoms could also come as a dissociative reaction or the flashback. It's not only memorizing, but it is like reliving the traumatic event as if it were happening again. And the intrusive symptoms could also be as a severe emotional distress or physical reaction to something that reminds you of the traumatic events. Okay. And the next symptoms or the next criteria is the persistent avoidance. So people with PTSD also showing symptoms of this persistent avoidance that include trying to avoid thinking or talking about the traumatic events. Okay, also they also avoiding places or activities or people that remind them of the traumatic events. The next one is negative thoughts and moods. The symptoms here include forgetting about the traumatic events, yeah, This could be also memory problems. You're not expected to, but you're like forgetting about the important aspect of the traumatic event. This is typically due to the dissociative amnesia happening there. And you might also experience negative thoughts about yourself, yeah, about other people or about the world in general. You feel like hopeless about the future, and you experience like distorted cognition, and as if that the traumatic event is because of your fault. Okay. And then you also might feel negative emotions such as horror, fear, anger, guilt, shame, over and over again. This also make you not interested in activities that you once enjoyed. Yeah, this also could appear as a difficulty in maintaining close relationship, and you kind of like feeling detached from family and friends. And you also might having difficulties in experiencing positive emotion or feeling emotionally numb. And the next one, or the last criteria of PTSD, is the symptoms of hyperarousal or reactivity. Yeah, that include irritability, the angry outbursts or aggressive behavior. This also includes self-destructive behavior such as drinking too much or driving too fast. You're being easily startled or frightened about something, yeah, and always being on guard or always being in danger, as if you're always in dangers, that might cause trouble in sleeping as well as trouble in concentrating. All right, so to be diagnosed with PTSD, an individual should experience the symptoms here for the duration of more than 1 month. If less than 1 month, then you will be diagnosed with other disorders, that is the acute stress disorder, and we will cover after the PTSD here. And of course, the symptoms should cause significant distress and impairment in the person's life. And in the DSM-5, the diagnosis of PTSD has a specifier here. So if the symptoms accompanied with dissociative symptoms, then should be specified with either depersonalization or derealization. Also, people may develop symptoms of PTSD even years after the traumatic event. So it means that they seems okay for several length of time, but then after 1 year or 2 years, the symptoms may appear. This could be happen as well. So also specify with delayed expression if the symptoms then appear after 6 months post-trauma. All right, for children, 6-year-old and younger, so for the diagnostic criteria, the sign and symptoms may slightly different than adult and adolescent. In the symptoms also may include reenacting the traumatic events or aspect of the traumatic events through play. And they also may experience nightmares, frightening dreams that may or may not include the aspect of the traumatic events. And the rest of the sign and symptoms the similar with adults and adolescent diagnostic criteria. All right, so the prevalence of PTSD, it's quite high here. So estimation of PTSD around the world, according to WHO, upper middle income countries around 2.3% of the population, and lower middle income countries around 2.1%. And in the US and the Canada, it's slightly higher there, 6.1% in the US and 9.2% in Canada. And the prevalence of type of the trauma or traumatic event that causes PTSD here is because of sexual violence is 33%. It's the highest here, including rape, childhood sexual abuse, or intimate partner violence. Yeah, and the interpersonal network is around 30%, including unexpected death of loved ones or life-threatening illness of a child. Yeah, and 12% for interpersonal violence here. Here include childhood physical abuse or witnessing interpersonal violence or physical assault or being threatened by violence. And the next one is exposure to to organized violence is around 3%. It's including refugees, kidnapped or civilian in war zone, yeah. And the next is participation in organized violence. So participation, yeah, participating, for example, like combat exposure, witnessing death or serious injury, or discovered dead bodies, or accidentally or purposefully caused death or serious injuries. This is around 11%. And other traumatic events is 12%, including life-threatening motor vehicle collision or natural disaster or toxic chemical exposure. This could be also causing PTSD. All right, so the risk and prognostic factors of PTSD are including pre-traumatic factors or the condition that we have prior to the trauma. It's including the temperamental or the it's include externalizing or anxiety problems that we have it prior the traumatic events, or prior mental disorders such as depressive disorder, panic disorder, or OCD that we have before, as well as environmental, lower socioeconomic status, lower education, exposure to prior trauma, especially during childhood or childhood adversity, or cultural characteristic, lower intelligence, or the minority racial or racial ethnic status, and the family psychiatric history also could interfere the risk of PTSD. And as well as the genetic and physiological factors will increase the risk of PTSD, including female gender, a young age at time of the trauma exposure, and genotypes, of course. And the peri-traumatic factors, or the factors during the traumatic events, also will interfere the risk factors here. It's including the severity of the trauma, or perceived life threat, or personal injury, interpersonal violence, or being a perpetrator also, yeah, becoming a risk factor here. And the post-traumatic factors is the temperamental, including negative appraisal or inappropriate coping strategies and development of acute stress disorder, of course. And then the environmental factors is the subsequent exposure to repeated upsetting reminders of the traumatic events. It could increase the risk factor of PTSD, as well as financial or other trauma-related losses. And social support is the protective factors of PTSD. And the gender-related, as I mentioned before, it is more prevalent among females than males across the lifespan here. And unfortunately, PTSD associated with suicidal ideation and suicide attempts. PTSD here is the model of the development of PTSD. Is one disorder for which we know that the cause, at least in terms of the precipitating events, or someone personally experienced a trauma and developed a disorder here. So we can develop PTSD when we go through trauma, right? Or see or learn about traumatic events, right? But then it doesn't like account for all of it, right? Whether or not a person developed PTSD, however, it's a surprisingly complex here, involving biological, psychological, and social factors, of course, the multidimensional model. And the stress diaphasis models comes into play again, since genetic factors here predispose individuals to be easily stressed and anxious, which then may make it more likely that a traumatic experience will result in PTSD. Right, so these factors seem to be true around the world because the reaction of trauma is actually similar across cultures. Okay, so again, PTSD is caused by a complex mix of stressful experience, yeah, including the amount and severity of the trauma, or have experienced other trauma earlier in life, such as childhood abuse, or having a job, then that increases your risk of being exposed to traumatic events, such as as a military personnel or whatsoever, right? And having other mental problems such as anxiety or depression could be also causing you more likely to develop PTSD. And also, as well as the biological, the inherited features of your personality that might inherited from your family, yeah, and as well as the way your brain regulates the chemical and hormones your body release in response to stress, that's related to biological and genetic as well. And finally, lacking of good support system of family and friend as a social factors could also interfere the development of PTSD. All right, so differential diagnosis. So PTSD might misdiagnosed with these several symptoms due to the similarity in the symptoms appeared, yeah. So for other post-traumatic and stress-related disorder, we should aware of the time frame of the symptoms that persist in the individuals. For example, acute stress disorder diagnosis is for 1 month length of the symptoms. If it's longer than 1 month, then PTSD diagnosis should be established, okay? And further, for other diagnosis, we should stick to all the symptoms and time frame for PTSD diagnosis. However, this is a bit tricky. Someone diagnosed with PTSD also diagnosed with other disorders, including depressive, bipolar, anxiety, and substance abuse disorder as much as 80%. This because people with PTSD experience, experiencing unbearable suffering, those developing symptoms of depression and anxiety as well. And they might use drugs for the maladaptive coping. And children with PTSD also often comorbid with oppositional defiant disorder and separation anxiety disorder, and also, as well as the major neurocognitive disorders here. And the treatment of PTSD. So getting effective treatment after PTSD symptoms appear can be critical to reduce that symptoms and improve function. So at present, the most common strategy to achieve this purpose with adults and adults is to work with the victim to develop a narrative of the traumatic events and to expose the patient for an extended period of time to the image. It's called the prolonged exposure therapy. Yeah. Recent research suggests that the effect of the exposure practices here might be strengthened by strategically timing the exposure type treatment with sleep. Yeah, that is very interesting. So patients in study were asked to take a nap, yeah, soon after the exposure or the exposure therapy here, because extinction learning appears to take place during slow wave sleep, and also because sleep quality reduces anxiety as well. And the next treatment could be cognitive therapy to correct the negative assumption about the trauma, such as blaming oneself in some way, feeling guilty, or both. Yeah, it's another part of the treatment. And EMDR, or the eye movement desensitization and reprocessing therapy here. It uses a patient's own rapid rhythmic eye movement for the REM. So this eye movement dampen the power of emotionally charged memories of post-traumatic event. All right, so the prevention. So evidence is now accumulating that early structured intervention delivered as soon after the trauma, as soon as possible, yeah, are useful in preventing the development of PTSD. Okay, so it means that turning to family members or friends or seeking mental health professional as soon as the traumatic event would be a preventive of developing later PTSD symptoms. All right, and we're moving to the next disorder is the acute stress disorder, which is very similar with PTSD diagnosis, symptoms, and etc. But the duration of the symptoms should be 3 days to 1 month. Okay, so remember this. So when the symptoms symptoms are there for within the 3 days to 1 month, the diagnosis should be acute stress disorder instead of PTSD. And the prevalence of acute stress disorders largely found in motor vehicle accident survivor, industrial accidents, interpersonal traumatic events such as sexual violence or mass shooting here. All right, so we're moving into the last disorder, is the adjustment disorder. What is this? So it's a group of symptoms such as stress, feeling sad or hopeless, and physical symptoms that can occur after you go through a stressful life event. So the symptoms occur because you are having hard time to coping. Yeah, your reaction here is stronger than expected for the type or event that occurred. So many different events might trigger symptoms of an adjustment disorder. So whatever the trigger is, the event might become too much for you. So stressor for people of any age that causing adjustment disorder include the death of a loved one, divorce or problem with relationship, general life changes, such as changes in work habit, for example, illnesses or other health issues in yourself or loved one, or moving to different home or different city, or worries about money, unexpected catastrophes such as maybe this pandemic happening here now, and also maybe like school problems, sexuality issues, family problem or conflict, and etc. So there is no way to predict that people who are affected by the same stress are likely to develop adjustment disorder. But your social skills before the event and how you have learned to deal with stress in the past may play a role here. So actually it is normal for us to experience distress when an unexpected incident or problem hit us, right? So it is normal for us to be to get through bereavement. So normal reaction of bereavement will not be considered as adjustment disorder here. Also, if the symptoms occurred more than 6 months after the stressor, you will be diagnosed with something else. So if the time frame for adjustment disorder diagnosis here is only within 6 months. The adjustment disorder diagnosis could be specified as well because often accompanied with different moods such as depressed, anxiety, or mixed. All right, this kind of disorder is pretty common, around 5 to 20% from the population. Moreover, in the hospital psychiatric setting, here is the most common diagnosis, is reaching to 50% of the diagnosis here. So this disorder can accompany most mental disorders and any medical disorders due to the nature of the symptoms. And that's all for trauma and stressor related disorder. Thank you for your attention. And I'll see you in the next topic. Bye.